Welcome to the Veteran Action Update Brief. I'm Mark Lucas, the founder of Veteran Action. Our guest today is one of the most fearless advocates we have for veterans. I can't think of a better champion we have in the United States Senate than Marsha Blackburn. Marsha, thank you so much for joining us.
I am delighted to join you and thank you so much for the great work that you do on behalf of the veterans.
You bet. In Trump's first term, he passed two of the most historic reforms at the VA. In 2017, he passed the VA Accountability Act, and the next year, he followed it up with the VA Mission Act, which was a truly monumental bill that would provide veterans more choice in their health care. Just recently, Senator, you're able to pass a very important bill for community care. Can you talk more about why your legislation is so important?
Oh, yes, indeed. One of the things that we are working toward is making certain that community care is going to be available to veterans in a way that they can use it. We want veterans to be able to receive timely care, the most convenient care to them, where they want to get that care. And we want them to be able to have a frictionless relationship with not only the VA, but with a physician that is there in their community that they actually want to have provide the care. So, our goal is to make certain that we remove those obstacles that exist with community care. And the Veterans Healthcare Freedom Act is a piece of legislation that really would expand these options for our veterans. I've been trying to get a 3-year pilot program when it comes to the expanded and enhanced community care so that we can actually see how this is going to work and see how when you put the veteran in charge and they are able to make those decisions and access that care and not have to wait around on somebody at the VA to, first of all, show up for work. A lot of them are still working remote. And secondly, get to their request and be able to take an action on that request and then get to the veteran. Sometimes there are months that pass and the veteran is not getting an answer. And we're trying to put the veteran in charge and not have the VA employee in charge of what that opportunity for the veteran is going to be.
Well, we 100% support putting the veteran in charge of their health care. And I believe that one of the greatest drivers of veteran suicide today is the lack of access to quality
Yes.
care. Just last year, we had two veterans commit suicide at the same hospital, at the VA hospital down in San Antonio. And one of those veterans actually wrote a book on veteran suicide. And he told his dad that the VA, they didn't want to talk to him, they just wanted to give him pills. And I believe that if we pass more bills like the Mission Act or your bill, the Veterans Healthcare Freedom Act or the Access Act, and if we give
Yeah.
veterans more choice, it'll be able to prevent more of these suicides. Can you talk about why the Mission Act was just so important and how we can really protect it and maybe further codify it through the Take Care of America's Veterans Act?
Yes, indeed. And, when we're talking about mental health, what we want is for the veteran to be able to have that relationship with someone so that when they need that contact, that person is there. And if they're having to travel 3 hours to get that care, or if they're having to wait months to get that care, then that is being denied. And we have a responsibility to these veterans to be able to meet their needs. So, yes, indeed, we want to get more access in mental health. We want it in the communities so that veterans can access it. And the other thing is having beds available when the veterans need this care, having those beds available in systems around the country instead of them having to wait for a VA bed and struggle all of those months. So, on the mental health, and increasing that access. That is what we're trying to do. Now, when you look at the Mission Act that President Trump passed in his first term, what that did was to change the way the VA looks at delivering care. Traditionally, with the VA and the union that is there, the Federal Employee Union, what they do is only think within the four walls of a VA hospital or a VA clinic. And the Mission Act has caused them to say, hey, wait a minute, if this veteran says they really want to go in their community because it's closer, they can get themselves to and from the doctor, they don't have to have people take a day off work to get them into the VA clinic, scheduling is easier, then we want to do that. And see, the Mission Act changed that and inserted choice as an option for veterans in how they get their care. So the legislation packages that we have now before the committee are all going to expand on the Mission Act. And Secretary Collins and his team, President Trump, they're all committed to opening these doors of opportunity for our veterans.
And earlier this year, you just introduced a bill called the Veterans Bill of Rights Act. And this is a very popular bill. We
Yes.
pulled it here at Veteran Action with Rasmussen. It had a 94% approval rating among military and veteran voters. You never see that on any issue. We see across the country, there are different states that have a Veterans
Mm-hmm.
Bill of Rights. We even see a taxpayer Bill of Rights at the federal
Mm-hmm.
level. Can you talk about why it's so important for us to codify a Veterans Bill of Rights at the VA?
Yes, absolutely, indeed. Because so many of our men and women in uniform, when they retire out, they don't have somebody sit down and say, here is a list of your benefits, and here's the information on how to access all of these benefits. And here is the expectation of when those benefits should be delivered to you. But having a Veterans Bill of Rights, where they know what they're entitled to. They know the care, the benefits. They know that there are community care options, and they are fully informed on what these benefits are, how to access that care, and also that that care is going to be delivered in a timely manner. That is something we are pushing, and that's why we have the Veterans Bill of Rights bill. And I will add to this, there's one thing when we talk about community care and expanding this choice and options for veterans, I want to make certain that the bill for that health care is going to the VA and not to the veteran. Because so many times what we're hearing is the veteran has to wait months to get that money back. So we want to make certain that bill goes directly to the VA.
And as I mentioned earlier, you fought a lot of challenges both as a member of the
Yeah.
House and now in the Senate. And I'm sure you're going to take that same energy back to your home state of Tennessee as governor. Can you talk about some of the biggest challenges you face to pass VA reform legislation?
Biggest hurdle I have on every bit of this, especially with community care and the Veterans Bill of Rights, is the union. And the union and this federal employees union, they're more concerned about themselves, their paychecks, than they are about the veterans. And I say that, but it's not every single employee and it's not every VISN, but it is a lot of the employees there. As I said, many are still working remote. Many are focused on other things since they're working remote and they're not working in a timely manner. You know, after we passed the PACT Act and when Biden was the president, the VA had about 1 million case backlog. Think about that. For healthcare and benefits, 1 million cases that were not addressed. That is completely unacceptable. That backlog has been worked down to your now I think between 100,000 and 200,000 cases that have not been resolved. But it just shows you what a heavy lift Secretary Collins had to do when he came in and took over the VA. So the union continues to fight this. It is one of the reasons to push so for community care, because the veteran is in charge and they can make their choices and options and not have to wait on somebody to show up for work, get back from a break, pick up their file that is on their desk, answer that email, get back to a caseworker or a VSO. So we continue to push forward with putting the veteran at the top of the list and taking their concerns into consideration first.
Well, we support your pro veteran agenda, and Veteran Actions made it very easy for our grassroots supporters to contact their lawmakers via the
Good.
Veteran Action Center. You can call your lawmaker, you can email them, you can reach them on social media, and you can do all three of those actions in less than 5 minutes. And as you scroll down the page, you can see that this was very effective in helping us confirm Sam Brown as the Undersecretary of Memorial Affairs for the VA, for Matt Lohmeyer as Undersecretary of the Air Force. It's the same proven platform that I used to help confirm Pete Hegseth as our Secretary of War. So be sure to go to veteranaction.org and support Marsha Blackburn's bills, particularly the Veterans Healthcare Freedom Act. And Marsha, I just want to say thank you so much for everything that you've done for veterans. I cannot understate this. I've seen a lot of members of Congress, a lot of United States senators, and none of them match your energy and your passion for veterans. So thank you so much for coming on our
Well, we're
show.
grateful for their service, and it is such an honor to advocate for them. Thank you for having me join you today.